Hi Jeff, how you doing today?
I'm, I'm all right. I'm feeling a little weird lately, and I can't explain it. I'm just, I feel off.
You feel off?
I just feel really off and not like myself, and just not like like I think a normal person should be feeling right now.
So you're not feeling like a normal person should be feeling.
I'm feeling a little anxious, a little jittery, a little, I don't know. I just feel weird.
Alright, so you have some anxiety, but you're not really certain of the feeling.
Yes. Yes.
Okay. I want to ask you a bit of an unusual question that is going to take some imagination to answer.
Okay.
I want you to bear with me if you can.
Okay.
Alright. So let's say that we know you have this problem that you're describing that's partially anxiety based at least. Say that you were to go home tonight
Mm-hmm.
and attend to your usual chores, and you're to go to sleep.
Okay.
All right. So you're asleep, and sometime during the night, a miracle occurs, and the problem you're having right now,
Mm-hmm.
in its entirety, is gone. So the next morning, you wake up, but you don't know the miracle has occurred.
Okay.
Does that make sense?
It makes sense.
So at this point, as you wake up, you don't know the miracle has occurred.
Mm-hmm.
How would you recognize that the problem is gone?
I think I would just feel better. Like, I don't know, maybe not be jittery. I guess.
Not be jittery?
Yeah, maybe I don't know. Maybe I would just feel better on the inside.
All right, try to think. That's good. Try to think specifically. Like, you first wake up.
Okay.
Let's go kind of through your day. So you first wake up. This miracle has occurred, but you don't know it's occurred.
Okay.
So you don't know about the miracle.
Mm-hmm.
You wake up believing that you would still have the problem,
Okay.
even though the problem's not there.
Okay.
So let's move through the day and see when you would be able to recognize, or what you would recognize.
So
is different.
I think during the first half of my day, I would like when I wake up, I do all the normal things, make my breakfast, shower, shave, all of that stuff. And I generally don't feel jittery then. It's just when I start to actually go out of the house and just thinking about getting to work and stuff, it starts to just get a little jittery on the inside.
So you may not notice the problem's gone when you're
Yes.
still at home.
Correct. But I think that once I actually got like to my office space, I think that that's when I'll start to say, "Hey, you're not feeling all jittery. Your palms are not sweating. You're not really anxious about going into work today." And something just starts to click, and it's like, "Hey, just feels right," instead of "this feels wrong and I shouldn't be here," or "I shouldn't want to feel like this."
All right. So the moment you get to work is when you think you'd really recognize that something about the problem has changed, that it might be gone.
I think so, and I think more I would actually understand or see the miracle had occurred is actually when I started to interact with my coworkers, because I think that that's where a lot of the jitteriness occurs, or at least that's what I've been noticing. That I'm seeing that anytime I'm really starting to interact with my coworkers, that my heart starts to race, my hand starts to get sweaty. I don't know what to say, I don't know what to do, and I think that if all of that started to disappear, then I think that I would have noticed that.
So that moment when you start to interact with your coworkers, you would notice that you're not reacting in the way that you're used to reacting.
Correct.
Which sounds almost like intense anxiety or panic.
Oh.
The way you describe it.
I never really thought about it like that, because I think that that's something that's naturally always been happening, and it really never occurred to me to look at my work situation to see if I eliminated that or those people, that all of the anxiety would go away. Because I think that even though when I come home, I'm still thinking about work and stuff is still happening, and I'm still worried about how I'm going to work with these people, that I still am a little jittery, but I'm not as jittery or sweaty or whatever, especially when I'm at the office.
So the largest chance you're going to recognize the problem is gone is during that time in the office.
Correct.
That's really, so there might be an after effect that that would be absent on your way home.
Correct.
But you feel like the symptoms, the problem, are really strongest at the office.
Correct. Yes. Right. Yes. I would say 100% yes. Especially when I'm interacting with just people, especially large groups of people, I think that that's when it really pops in, and I just don't know what to do with myself. And I think I could see that if we had a group meeting, I think I would really notice it then, because I wouldn't be worried about what I'm saying or how other people are viewing me, or if people think I'm dumb or anything like that. I think that I would just be able to say what I needed to say.
So if the problem wasn't there, you'd be relaxed and confident during these meetings.
Yeah, I think I would be. I think be really confident, and also I would be very sure of myself, because I would know that this is what I'm saying is right and what I'm doing is right, and I wouldn't have to worry about if my coworker's talking behind my back or if my coworker's laughing. Like, I wouldn't even care if they're on their phones, because I know that what I'm presenting is going to be right.
Right. So it seems like I've used this question, which we call the miracle question.
Okay.
Right. It seems like it's helped you to identify what's going on a little bit. It sounds like a social anxiety type symptom set that you have going on.
Okay.
Right. And that's something we can certainly work on.
Perfect.
Right.
Perfect.
And maybe it's giving you some insight into how that social anxiety seems to function throughout the day.
Okay.
When it's more intense at work, when it's
Mhm.
less intense as you come home.
Mm-hmm.
And in the morning when you wake up, really it doesn't seem like it's too bad at all.
No.
So it's giving you an idea how those symptoms ebb and flow through the day and what they might mean, what might be causing them.
Mm-hmm.
Does that make sense?
That makes complete sense, I think.
We'll work on it.
Okay.
Work on it to put some more framework around it. But give that some thought, what's going on with the problem in terms of when it occurs, you're recognizing how it's work,
Mm-hmm.
and reflect on that a bit, and then I'll see you again in about a week, and we'll start moving through and see what we can do about this social anxiety.
Okay, perfect.
Does that sound good, Jeff?
That sounds wonderful.
I'll see you then. Thanks a lot.
Thank you.